welcome back. Well, it is National Wear Red Day. It's something nationwide. It's an effort to raise awareness about heart disease. It's the #1 killer of women. More than 4 in 10 women in the U.S. are living with some form of cardiovascular disease. That does include heart disease and stroke. But there are things that you can do about it. I'm joined now by Dr. Ricardo Siller. He is with SIH. Doctor, welcome to the show again.
Thank you so much. Thank you for inviting me. I'm very happy to be here. And go ahead with your question.
Well, we're happy about having your expertise on the show. Of course, we're going red today for women's heart health, but we do need to talk about that. I mean, that's a major killer for women. Let's go right into it. What are some of those important warning signs for heart disease in women?
Well, it's important because, you know, in women, they tend to have alternative symptoms, not the classic crushing
Really?
chest pain, for example.
Okay.
So 1 out of 3 women that had an MI, they didn't feel any like chest pain.
Really?
So in women, symptoms can be more like, for example, extreme fatigue, shortness of breath, and then jaw pain, back pain, or even neck pain, and numbness. So many people that I operate on, many women that I operated on, at the end, they tell me, well, I thought it was just like stress or anxiety, but I never felt like the chest pain, right?
Yeah.
So it's important to keep in mind that it can present different than in men.
Sure. I mean, I would imagine, like you just said, that they really wouldn't have any idea that they were actually suffering from something cardiovascular. Wow.
Exactly.
Okay. Well, then that brings me to our next question. When do you need to start paying attention to those kind of signs? Like, is there a particular age group that women fall into where you need to say, okay, I need to start thinking about my heart health?
Well, the age where I see most of my patients is usually 50s, 60s, and 70s.
Okay.
But that's when the heart attack already happened.
Okay, that's
So
when you're already in the middle of
You're
it.
already in the middle of it.
Okay.
So you have to start thinking about it in your 30s and your 40s. On those, at that age, the disease can be reversible still.
Okay.
And it's, of course, very important to look at your blood pressure, to know what's your normal blood pressure, to know what's your blood sugar, and your cholesterol.
Okay.
And also try to have about 3 hours of exercise per week. Now, if you do that, if you know the numbers, then you can, you know, the disease can, instead of progress, it can go back and improve, right? So that's the age that we have to start paying attention.
All right, so about our 30s, our 40s, we really need to start paying attention to that heart health and, well, really knowing what our vitals are normally so that way we can pay attention in the future.
Exactly.
Okay, that's great.
And, you know, women have the specific thing that, for example, estrogens, they have some protective effect on coronary artery disease. But then after menopause, that protective effect goes away.
Okay.
Also, during pregnancy, there's some diseases that can increase the risk of heart disease, and that is preeclampsia, which is high blood pressure during pregnancy, and gestational diabetes, which is high blood sugar during your pregnancy.
Okay.
So those are extra points that women have to
We have to take those into consideration as well. Yeah,
Exactly.
extra risks for the women out there.
Yes.
Well, speaking of that risk factors, do you need to also think about things like your family history or diabetes whenever you're thinking about heart health?
Exactly. So there are about 4 specific points that you need to know. So genetic history, heart attack in your parents or siblings before 50 years old.
Okay.
The cholesterol level, because there's hereditary hypercholesterolemias, which is high cholesterol genetically,
Right.
blood pressure, and diabetes.
Okay. All right. Well, we've got about 30 seconds left, Doctor. Do you care to tick off a couple of the things that women can do preventatively to keep themselves out of the operating room in the end?
Of course. So, as we mentioned, control the cholesterol, the blood sugar, and if I could say one, the high blood pressure needs to be controlled. That's one of the major risks. Also, the weight loss. Now there's a lot of ways to help.
Definitely.
Like medications and injections that can help you lower your weight. And specifically, what is very important, do not dismiss or ignore symptoms, because that's what happens a lot. Women would say, oh, it's just stress, or I'm just tired. And they seem to be a little bit more resistant than men sometimes, so they just don't care about that pain, right? So
Right.
you need to take it into account, and whatever doesn't feel normal, just go and get evaluated.
And that's probably across the board, doctor, isn't it? I mean, it's not only for heart health, but if you're experiencing something that's out of the norm, it's something that's giving you concern, you probably need to reach out to your regular care provider, right?
Exactly, and especially
right.
because when that pain is small, it can be treated,
That's right.
okay? So it can still be treated.
Before it gets out of control.
Exactly.
All right, doctor. Thank you so much for
Thank
coming
you.
on the show today.
Appreciate
We
it.
really appreciate you coming in and sharing
Thank
some of
you.
your
A pleasure.
expertise on
Appreciate it.
cardiovascular health. All right.